Welcome to the deep dive. This is where we take a whole stack of sources, it could be articles, research, our own notes, and really boil them down for you.
Yep, sift through it all.
Exactly. Find those key nuggets of knowledge. Our mission, as always, is to give you that shortcut, get you properly informed, maybe find a few surprising things, and hopefully keep you hooked along the way.
Sounds good.
So today we're diving into, well, it's an often hidden world, isn't it? But it's really significant. Internal gastrointestinal parasites in pigs. Our sources are basically excerpts pulled from these big guides on swine gastrointestinal parasites, identification and control.
Right, the comprehensive stuff.
Yeah. And the goal for you today is to walk away really understanding these pervasive health issues. We'll cover everything from, tiny little eggs.
Unbelievably tiny.
All the way up to major economic hits and even some, well, pretty surprising links to human health, too.
Indeed. And, these internal parasites, they really are a major health concern for pigs, especially if you're talking about outdoor systems, pasture-raised pigs.
Okay.
What's really crucial to get right off the bat is just how much they can hammer productivity, seriously impact it.
How so?
Well, you're looking at things like reduced growth, poor feed efficiency, meaning they eat more but gain less weight, and sometimes, in the really bad cases, even death.
Wow.
So understanding the common types, knowing their life cycles, which can be pretty complex, spotting the clinical signs, sometimes subtle, and figuring out the best management strategies, it's all absolutely vital.
Yeah.
And it's a great example, actually, of how these seemingly small, almost invisible details can ripple out and have these, well, enormous consequences for the whole industry.
Okay, let's unpack this then. So to give you the full landscape, we've zeroed in on 7 of the most common parasites we'll be talking about.
Right.
Some names might ring a bell, like the large roundworm, Ascaris suum. That one's kind of infamous.
It is. Definitely the big one.
Then you've got the whipworm, Trichuris, and the nodular worm, Oesophagostomum. We'll also touch on the intestinal threadworm, Strongyloides ransomii, the red stomach worm, Hyostrongylis rubidus, and this one sounds quite dramatic, the thorny-headed worm, Macrocantholrhynchus hirudinaceus.
Huh. Yes, it does.
And finally, a type of Coccidia, Isospora suis.
And look, this isn't just, rattling off a list of Latin names. These guys represent a real, persistent threat, often underestimated, I'd say.
Underestimated how?
Well, because they often work subclinically. You don't always see sick pigs, right? But underneath, they're just constantly chipping away at health, welfare, and ultimately the farmer's profit, a kind of silent drain.
A silent drain, okay. So let's really dive deep then into some of the main culprits here, starting with the big one you mentioned, the large roundworm, Ascaris suum.
Right.
Our sources flat out call this the most common and economically damaging intestinal nematode of pigs worldwide.
Okay.
That's quite a statement. What makes it so bad?
It is a huge claim, isn't it?
Yeah.
It's totally deserved. The life cycle really tells the story. So the eggs get shed in the pig's feces.
Okay.
And then they develop out in the environment, becoming infective larvae inside the egg. Pigs then swallow these infective eggs.
Right, just rooting around in the soil or contaminated feed.
Exactly. Once they're ingested, the larvae hatch out. And this is where the real damage starts, even early on. They go on this kind of damaging tour.
Sure.
Yeah, they migrate first through the liver, then into the lungs. They get coughed up, swallowed again, and then they finally make it back to the small intestine to grow into adults.
Wow, that's quite a journey.
It is. And the pre-patent period, that's the time from when the pig swallows the egg until the adult worm starts laying its own eggs. That's about 6 to 8 weeks.
Okay.
But here's the kicker, the eggs. They are unbelievably tough.
How tough?
We're talking survival for up to 15 years in the soil. 15. And they're resistant to most of the common disinfectants people use.
15 years, good grief.
And get this, a single female worm can churn out up to 2 million eggs per day.
2 million a day. Okay, the scale is just mind-boggling.
It really is. And those numbers, that resilience, that's why the impact is so huge.
So the sources mention this twofold impact, both clinical signs and economic effects. Let's break that down. First, the larval migration part.
Right. So as those larvae tunnel through the liver, they cause inflammation and scarring. This leads to these whitish spots or lesions called milk spots.
Milk spots. Okay.
And those milk spots are a major reason why livers get condemned at the slaughterhouse. That's a direct economic loss right there.
Straight off the bottom line.
Exactly. And then when the larvae migrate through the lungs, it causes respiratory issues, coughing, difficulty breathing. They call it thumps. Obviously, that affects the pig's growth and, well,
Humps. Okay, so that's the larval damage. What about the adult worms once they settle in the intestine?
that's the second part of the punch. The adults are big worms, and they're literally competing with the pig for nutrients in the gut.
Stealing their food, basically.
Pretty much. And that directly leads to reduced feed efficiency the pig eats, but doesn't gain weight as it should and slower growth overall.
Are there hard numbers on this, the economic cost?
There are. The estimates are pretty stark. For Ascaris, they reckon it costs about $60.1 million every year just in extra feed costs in the U.S.
60 million just in feed.
Just in feed. And then add maybe $17.5 million lost from those liver condemnations in Eastern Europe, for example. The numbers add up fast.
That is staggering. Do you think, do most producers really grasp these figures, or is it more of an invisible cost, like you said?
That is a really good question. I think the really large integrated operations, they're definitely aware. They track everything.
Sure.
But for many maybe smaller or mid-sized farms, these costs can kind of fly under you see slower growth maybe, but you don't always pin a specific dollar figure directly onto the worms.
Right. It just seems like the pigs aren't doing well.
Exactly. And beyond the money, really heavy infections, they also cause nasty diarrhea. Pigs can become emaciated. That's a serious animal welfare issue, too.
So how do you diagnose it then, if it can be subclinical?
Well, for a mature infection, you can do a fecal flotation test. You look for those typical thick-shelled Ascaris eggs under the microscope.
Okay.
Or, if a pig dies or is slaughtered at necropsy, you clearly see the milk spots on the liver, or find the actual adult worms in the intestine. They're quite large.
But you mentioned the pre-patent period earlier.
Right, and that's key. Fecal egg counts, they're not reliable for diagnosing the acute disease. Why? Because a lot of the damage, the liver migration, the lung migration, happens during that 6 to 8 week pre-patent larval stage before the adult worms are even producing eggs to be found in the feces.
Oh, okay. So the damage is already done before you can easily detect it with a fecal test.
Precisely. Makes early control even more important.
Okay, so that's the heavyweight champion Ascaris. Let's move on to another important one, the whipworm, Trichuris suis. You said this one hangs out in the large intestine.
That's right. Trichuris sets up shop in the large intestine. It also has a direct life cycle, no intermediate host needed.
Simpler, then.
A bit simpler, yes. Pigs swallow the infective eggs, the larvae hatch, and head to the large intestine, where they embed themselves in the lining, the mucosa, and then mature into adults.
Okay. And pre-patent period.
Similar to Ascaris, actually. About 6 to 8 weeks.
And the name? Whipworm.
Comes from its shape. The adult worm has this long, thin, whip-like front end and a thicker back end. Very distinctive.
Right. And are its eggs as tough as Ascaris eggs?
Extremely tough. Maybe not quite the 15 years, but they can remain infective in the soil for up to 11 years. So still incredibly resistant.
11 years is still a very long time. So what kind of trouble does this one cause? What does an infection look like?
With heavy infections, it causes a pretty nasty inflammation of the large intestine. Colitis or typhlitis.
Okay.
And that leads to a very characteristic diarrhea. It's often described as mucoid, maybe with flecks of blood in it.
Not pleasant.
Not at all. And the pig's affected, they show poor growth, they lose weight, can get severely dehydrated, all the signs of intestinal distress.
And the economic hit here, is it similar to Ascaris?
It's mainly about that poor performance, reduced feed efficiency again, and just bad growth rates. Some experimental studies showed average daily gain ADG.
Right, how much they gain per day.
Yep, that was reduced by anywhere from 6% up to 35%. And feed conversion ratio, FCR, how well they turn feed into meat.
Got it.
That got worse by 3% to 33%. So significant impacts on productivity, definitely.
Is diagnosis tricky for this one too?
It can be, yeah. Couple of reasons. The female worms, they shed eggs sporadically, not continuously like Ascaris, so you might miss them on a single fecal test. And just like with Ascaris, the clinical signs, the diarrhea and poor growth, they often show up during that pre-patent period, before you'd find any eggs in the feces anyway.
So you see the problem before you can easily confirm the cause.
Exactly.
Yeah.
Makes diagnosis and timely treatment a bit of a challenge.
Okay, moving along. Let's talk about the nodular worm, Oesophagostomum. Sounds lumpy. Our sources say it's common worldwide, especially in older pigs.
That's right, Oesophagostomum. Its life cycle is also direct. Larvae get swallowed, and then they penetrate into the wall of the large intestine.
Into the wall itself?
Yes. And that's where they form these characteristic nodules, little bumps or knots in the gut wall. That's the hallmark of this parasite. Pre-patent period is a bit shorter, maybe 3 to 6 weeks.
So those nodules must cause problems.
Well, here's the interesting thing. Most infections are actually subclinical. The adult worms living in the gut lumen don't seem to cause massive issues on their own, usually.
Oh, so where's the economic damage then?
It comes almost entirely from those nodules in the intestinal wall. The issue is that the large intestine specifically is often used for sausage casings.
Wait, really? Sausage casings?
Yep, natural sausage casings. And if the intestine is full of these nodules from the larval damage, it gets condemned at slaughter. Can't be used.
So it's not about the pig's growth rate this time. It's about losing a valuable byproduct because of these little lumps.
Exactly. It's a perfect example of how a parasite can hit the economics in a very specific, targeted way. A direct hit to the value of the carcass, tied directly to, well, our breakfast sausages.
Ha! Never thought about worms impacting my sausage casing supply chain. Okay, next up, the red stomach worm, Hyostrongylis rubidus, associated with thin sow syndrome.
Yes, Hyostrongylis. These are small, slender, reddish worms, and they live, as the name suggests, in the stomach.
Okay.
And heavy infections, they cause gastritis, inflammation of the stomach lining. This leads to decreased appetite, weight loss, sometimes anemia because they can cause bleeding.
And thin sow syndrome.
It's often found in sows that are losing condition, looking thin and unthrifty, especially around farrowing or during lactation. This worm is considered a contributing factor. In really severe cases, you can get gastric ulcers, and sows can even die from blood loss.
Pretty nasty for a small worm. Okay, then we have the intestinal threadworm, Strongyloides ransomware.
Ah, yes. Strongyloides. Yeah. This one is tiny, but it's a really important one, particularly because it primarily affects very young pigs, neonatal piglets.
Newborns.
Yes, in their first couple of weeks. And it has a really unique and quite complex life cycle.
Yeah.
One absolutely critical route of transmission is directly from the sow to her piglets through the colostrum.
Through the first milk.
Exactly. At the very first nursing. The infective larvae are right there in the milk.
Wow, that's direct.
Incredibly direct. Infection can also happen if larvae penetrate the piglet's skin from a contaminated environment, or if they ingest larvae. But that colostrum route is key for early severe infections.
And what does it do to these young piglets?
In heavy infections, typically seen when the piglets are around 10 to 14 days old, it causes severe, intense diarrhea scouring, they call it. Acute dehydration follows quickly, and mortality rates can be very high. It's devastating for litters.
Gosh, it really highlights how vulnerable those little piglets are, doesn't it? A microscopic enemy causing such havoc so early on.
It really does. A major challenge in the farrowing house.
Okay, just so we have the complete rogues gallery here, let's briefly touch on the last two you mentioned.
Sure. There's Macrocantharynchus hirudinaceus.
The thorny-headed worm.
That's the one. Sounds like something out of a fantasy novel, doesn't it?
It really does. Not something you want moving in.
Definitely not. So infection happens when pigs eat certain beetles or other insects. Dung beetles are common hosts that contain the infective larvae.
So it needs an intermediate host.
Yes, unlike the others we've focused on. Once ingested, the larvae attach to the wall of the small intestine using this, well, thorny proboscis, this spiny attachment organ.
Ouch!
Yeah. It's relatively rare compared to Ascaris or whipworms, but heavy infections can actually perforate the intestine, leading to peritonitis, which is very serious.
Okay. And the last one, Coccidia.
Right, Oesophagostomum suis. This isn't a worm, it's a protozoan parasite, a type of Coccidia. It mainly affects piglets, again, typically between 5 and 15 days old.
Around the same age as Strongyloides.
Yes, often causes problems in that same window. It invades the cells lining the small intestine and causes diarrhea, usually described as creamy or watery dehydration, and poor growth. It doesn't usually have super high mortality like Strongyloides can, but it definitely sets the piglets back.
Okay, so we've got this whole spectrum of parasites, different life cycles, different impacts. What does this all mean when it comes to actually controlling them? It sounds like just reaching for a dewormer isn't going to cut it, right?
Exactly right. You absolutely need an integrated approach. Just relying on drugs alone, it's not sustainable and often not fully effective. You have to combine strategic use of anthelmintics, the deworming drugs, with really robust management and hygiene practices.
Okay, let's break that down. What does strategic deworming look like?
It means having a planned program, not just treating randomly. It needs to be tailored to the specific farm, the type of housing, the parasite risks.
Makes sense.
For example, it's really crucial to treat sows about 7 to 14 days before they farrow, before they give birth.
Why then specifically?
Because that helps prevent the transmission of parasites like Ascaris suum and especially Strongyloides ransomii through the colostrum to the newborn piglets. It cleans up the sow just before the critical period.
Ah, okay, that makes sense.
Then you typically also treat the piglets themselves, maybe at weaning time, and again when they move into the grower or finisher pens to handle infections they pick up later.
And there are different drugs for different worms.
Yes, there's a range of effective anthelmintics. You've got drugs like ivermectin, fenbendazole, pyrantel, levamisole, and for coccidia like isospora, you'd use something different, like toltrazurol.
Okay.
And another really important point is rotating these dewormers regularly. Using the same drug class over and over can lead to resistance where the worms just don't get killed by it anymore.
Right, drug resistance is a huge issue in lots of areas.
Absolutely. Parasite control is no exception.
You mentioned hygiene and management being critical. Given what you said about those eggs surviving for years, 11 years, 15 years, does normal cleaning and disinfection even make a dent? Or do you need something more, I don't know, extreme?
That's honestly the core challenge. Because those eggs, especially Ascaris eggs, are so incredibly resistant in the environment, your standard barn disinfectants. They often don't do much to the eggs themselves.
So what does work?
Thorough cleaning is paramount. Physically removing all the manure in organic matter, especially from farrowing crates between batches of pigs.
Getting rid of the source.
Exactly. Using detergents can actually help break down that sticky outer layer of the Ascaris eggs, making them easier to wash away.
Right.
But for actually killing the eggs that remain, you might need disinfectants specifically formulated to target parasite eggs, which are often harsher chemicals. Or sometimes people resort to things like intensive steam cleaning, or even using flame guns on concrete floors to kill them with heat.
Flame guns. Wow, okay, that's serious cleaning.
It is. It shows how tough these things are. And for pigs raised outdoors, obviously you can't steam clean a pasture. So there, it's about pasture management.
Like what?
Things like rotating pastures, not keeping pigs on the same ground year after year. Tilling the soil when pastures aren't in use can help expose eggs to sunlight and drying, which can reduce survival.
Okay. Any other key management tips?
Yeah, things like using all-in, all-out production systems are really helpful.
Yeah.
That means moving whole groups of pigs together and then completely emptying, cleansing, and disinfecting the barn before the next group comes in. It breaks the cycle of infection.
Right. No continuous overlap.
Exactly. And another simple but effective thing is just physically washing the sows before they go into a clean, sanitized farrowing crate.
Mm-hmm.
Wash off any manure and eggs stuck to their skin.
Makes sense. Clean pig, clean pen.
That's the goal.
So we've covered the pigs, the parasites, the control, but you hinted earlier at a connection beyond the farm, something that links directly to human health.
Yes, the zoonotic potential.
Meaning they can infect people.
That's right. Zoonotic means a disease that can be transmitted from animals to humans. And it's now very clearly understood that Ascaris suum, the pig roundworm, can absolutely cause ascariasis in humans.
How does that happen?
Same way pigs get infected, essentially, by ingesting those highly resistant infective eggs from soil that's been contaminated with pig manure, maybe through contaminated vegetables, or children playing in contaminated soil.
And what happens if a person gets infected?
The clinical signs are pretty similar to infection with the human roundworm, Ascaris lumbricoides. You can get respiratory symptoms, like coughing, during that lung migration phase of the larvae.
Because like the thumps in pigs.
Exactly. And then abdominal discomfort, sometimes more serious issues, from the adult worms living in the intestine.
That's quite concerning. Are there others?
Well, what's really fascinating, and perhaps less widely known, is that Trichuris, the pig whipworm, is also reported as being zoonotic.
The whipworm, too.
Yes, it seems capable of causing at least transient temporary infections in humans. But here's the really mind-bending twist. Trichuris eggs, the pig whipworm eggs, are actually being seriously investigated as a potential therapy for humans.
A therapy.
For autoimmune diseases, like Crohn's disease or ulcerative colitis. The idea, simplified, is that controlled exposure to these worm eggs might help modulate the human immune system, kind of calming down the overactive response that causes these diseases. It's called helminthic therapy.
So infecting people with pigworms on purpose to treat human diseases, that completely turns the idea of parasites on its head.
It absolutely does. It's a wild concept, still experimental in many ways, But it highlights this incredibly complex relationship we have with these organisms, sometimes harmful, sometimes potentially helpful.
Wow. Okay, we have definitely taken a deep dive today
No, it's like,
into this, hidden world of swine parasites. It's clear how intricate their life cycles are, how diverse the impacts can be, from those liver milk spots all the way to condemning intestines needed for sausage casings,
right.
and just how vital that integrated control approach is, not just for the pig's health, but clearly for the producer's bottom line, too.
Absolutely.
Yeah.
And if you sort of zoom out, connect it to the bigger picture, recognizing these often hidden costs, both the economic ones and the health ones, it really empowers producers to put robust control programs in place.
Yeah.
Programs that don't just protect the productivity and welfare of the herd, but as we've seen, can also tie into protecting public health.
So maybe the thought to leave you with is this. How can the health of just one species, even one we farm, like pigs, have such incredibly far-reaching ripples? Not just economically hitting profits in unexpected ways, but also potentially affecting our own health, both negatively through zoonotic transmission and maybe positively through these potential new therapies. It really underscores how interconnected everything is, doesn't it?
It really does. And it raises that question,
Sure.
what other areas of animal health, maybe things we currently overlook, might hold similar surprising implications, whether economic or for public health? There's always more to uncover, I think, in that really intricate balance between health, animals, and the environment we all share.